Hello guys, welcome back to my YouTube channel. From this video, I'm going to discuss about the anatomy of middle meningeal artery and the clinical relevance of it. So, let's get going. Middle meningeal artery origins from the first part of the maxillary artery. When you talk about the head and neck anatomy, middle meningeal artery is a very important artery. Let's see why it is important. First, we have to see what is the origin and the cause of the middle meningeal artery. So, it origins from the maxillary artery, the first part of the maxillary artery in the infratemporal fossa. This is the infratemporal fossa. You can see this is the external carotid artery. Maxillary artery is the one of terminal branch of the external carotid artery. So, this is the maxillary artery. And this is, you can see, this is the middle meningeal artery. Middle meningeal artery origins from the first part of the maxillary artery. Once it origins from the first part of the maxillary artery, it ascends towards the roof of the infratemporal fossa and it enters into the foramen spinosum. This is the foramen spinosum, and in the foramen spinosum, middle meningeal artery accompanies by nervus spinosus, which is the meningeal branch of the mandibular nerve. At its origin, you can see two nerve roots surrounds it. What are those two nerve roots? Those are the two roots of the auriculotemporal nerve. These are the two nerve roots of the auriculotemporal nerve. Then, once the middle meningeal artery and its branches, once the middle meningeal artery enters into the middle cranial fossa through the foramen spinosum, the main trunk and its branches are located in the extradural space. It is an important point. It is situated in the extradural space. And then the artery, the main trunk, passes anterolaterally on the floor of the middle cranial fossa. After it enters into the middle cranial fossa, it passes slightly laterally and anteriorly on the floor of the middle cranial fossa. And then it divides into main two branches as anterior division and the posterior division. Anterior division is also called as the frontal branch, and the posterior division is also called as the parietal branch. This division is on the greater wing of the sphenoid bone. Then, when we talk about the anterior division of the middle meningeal artery, it lies in a groove on the greater wing of the sphenoid bone at the terion. This terion is a point where these four bones meet together. This is parietal bone, frontal bone, sphenoid bone, and the temporal bone meets together at the terion. Thereafter, this anterior division breaks up into several branches and then supplies the dura mater and cranial bones, and then it goes far towards the vertex of the skull. Once branch grooves the antero-inferior angle of the parietal bone, it overlies the precentral sulcus of the brain as well. Then, the posterior division. The posterior division of the parietal branch arch backwards on the squamous part of the temporal bone and supplies the dura mater and cranial bones and enter towards the lambda. So, those are the two main branches of the middle meningeal artery. There are several other minor branches as well. Those are the minor branches. The ganglionic branch, which supplies the trigeminal ganglion. Then you have the petrosal branch, which passes through the greater petrosal hiatus to enter into the petrous temporal bone and supplies facial nerve geniculate ganglion and the middle ear. Then you have the superior tympanic branch which enters the middle ear along the canal for tensor tympani muscle. Then you have the temporal branch, and it enters to the temporal fossa to anastomose with the deep temporal branches of the maxillary artery. So those are the minor branches. And middle meningeal artery primarily supplies the cranial bones, diploe, and the dura mater of the skull. Apart from these, those are the minor branches. When we talk about the clinical relevance of the middle meningeal artery, it is related with the extradural hemorrhage. It is a very important point. It maybe appears in MCQs as well. This pterion is a very thin bony part. So, the fracture of side of the skull involving the pterion is likely to tear anterior branch of the middle meningeal artery. So, once the arterial injury causes, it gradually accumulates blood in the extradural space. Initially, the symptoms may be confusion and irritability, but later on, there is a hematoma formation and it can exert a pressure on the underlying precentral gyrus, causing hemiplegia. So this is an extradural hemorrhage. It is between the cranium and the dura mater. So, and also, once the extradural hemorrhage is large and long lasting, it can cause the supratentorial compartment to herniate through the uncus of the temporal lobe. Sorry, there is a mistake. Once it is large and long lasting, the extradural hemorrhage in the supratentorial compartment, it can cause herniation of the uncus of the temporal lobe through the tentorial notch, and in such cases, midbrain is shifted to the opposite side and its crus cerebri is compressed by the sharp edge of the tentorium. Those are the effects of extradural hemorrhage. Here is a wave. You can see the extradural hemorrhage on a CT scan. It looks like a biconvex in shape. So that's all about the middle meningeal arterial anatomy and its clinical relevance. Hope you guys clearly understood about the origin and the cause as well as the termination and also the clinical relevance. Thank you for watching.